Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And today I'm here with Dr. Sylvia Murphy-Tighe, and we're going to talk about her upcoming presentation here at Gold. Welcome, Sylvia. It's lovely to have you here.
Thank you very much, Kristen.
Wonderful to have you here. You are going to speak at our new Gold Birth and Beyond Symposium 2022. It's just around the corner here. But before we dive into your topic as well, first of all, I would like to know, where in the world are you?
So I am working at the University of Limerick. I'm a midwifery lecturer. I'm a nurse and midwife. And the University of Limerick is in the Midwest of Ireland. So we're on the western coast, and I'm waving across to you in the States and Canada.
That's wonderful. I absolutely, that's just what I love about the online, way of learning, is we can all be in different countries, continents, wherever we are, and time zones, and learn from each other and learn from speakers like you. It's absolutely wonderful. Well, thank you for sharing that, and also your professional background here. Your topic at the symposium is concealed pregnancy, a misunderstood phenomenon. I know you're quite an expert in that topic and that field. You have done research on it. First of all, how did this become a topic of interest to you?
So the area of concealed pregnancy really came around as an area of interest, is that I had encountered it in clinical practice. But as an educator in a third level institution, I was aware that students were coming back and, sharing stories from antenatal clinics and from maternity, the labour ward, and they were still encountering concealed pregnancy. So it was something that I was also keen then to look at moving on in my career in terms of doing doctoral research. So I think naively I fell upon this area. I found it quite fascinating to think that there's a lot of myths and stereotypes about it, and I started to read a little bit about it, and there was very little. And actually I think that struck me, particularly in an Irish context, because we had a whole revelation a number of years ago about that involved concealed pregnancies and mothers that had enforced adoptions. So I think that that whole opening up of Irish society and finding out what had happened in the past, along with the students talking about the women they were encountering, led me really to pursuing it as an area of research.
Well, thank you for sharing that. Yes, and you are so right. There is not much information out there. I remember that when I was a midwifery student, and we were getting together in class between clinic, and there was a student also saying, oh, there was somebody walking in and, in labor, not knowing they were in labor, and how could this be? And you're so right. There's so many misconceptions, stereotypes, around this topic, and something nobody really talks about. And then we see cases in the media, and it's blown. There's so much shame and guilt associated with that as well. So there is a lot to talk about and to learn here, and I'm so grateful that you're presenting this here at Gold to us. When you did, and you're presenting case studies, and you're presenting your research here at Gold, along all these years that you've been researching this topic, what surprised you, or what came up that you yourself were thinking, oh, that is different from what you kind of had expected?
I suppose there was a couple of things that struck me, and the first thing really, and I suppose this presentation is going to be one that is of a very sensitive nature, and people can be impacted in very many ways. They may be adopted themselves, they may, be an adoptive parent. So I think there's a lot of sensitivity. What I didn't I knew it was going to be a sensitive area I was approaching to research, but I never, in my wildest dreams, really thought I would encounter the degree of trauma that I came across. And the way we worked to advertise and publicize the study was through media, and was through the newspapers and through social media, and women all came forward themselves looking to talk. So I had 54 women initially came forward after a press release, and then an additional 6 women. So there was 60 women who came forward very willing and able to tell their stories. And of those, I interviewed 30. So that is probably the biggest shock to me, really, was the degree of trauma that women had encountered in their earlier lives, and how difficult an experience concealed pregnancy was for them.
When we think of concealed pregnancy, we often think of teenagers. Is that mainly the demographics, or, you know, not only, right? I mean, what have you encountered?
You're absolutely right. There is the stereotype, you know, and yes, of course, a young woman who's a teenager may fall pregnant, may have an unplanned pregnancy, and that certainly is the case. But no, from the international research that's conducted in Ireland, in Germany, there's a case report study from Ohio, and also, did I mention a Welsh study? So concealed pregnancy up to birth would occur about 1 in 2,500 births, and that's as prevalent or as common as a twin pregnancy. Women then may conceal for shorter durations of time, so 5 to 6 months, and maybe then they're found out. So that would happen, according to the published literature or scholarship that is available, about 1 in every 400 or 500 pregnancies. So it is much more common than we might appreciate. Because
Yeah.
a clinician will only perhaps in their career come across, a couple of cases, and you might have a baby who's born before arrival in hospital, and it's not known was that concealed or not, or there may be a query, there may be no antenatal care, and the presentations can vary. A mother might come in late in labor, but may have different reasons, and I think by women being able to come and talk in confidentiality in a research situation or research capacity, they felt safe to be able to explore the wider psychosocial reasons behind why they concealed the pregnancy. And very many of them disclosed they were fully aware of the pregnancy and really struggled with being pregnant.
Yeah, a lot of trauma, as you mentioned, there. You did something, I read that you did something that I found very interesting and fascinating. You brought a visual art exhibit to Ireland from Australia. It was titled "The Spaces Between Us." Can you talk about that a little bit?
Yes. So during the course of my fellowship and while I was doing my PhD, I came across a fantastic paper that was written by Dr. Amanda Gardner, and Amanda is based in Edith Cowan University in Australia, and she is a writer, creative writer, and has a wide kind of area of wide research interests in history and writing. And so I linked with her, and she happened to be coming, she came via Ireland after a conference, and we got to meet. And as part, she had looked at the area of infanticide. And again, a related subject to concealed pregnancy. And she had worked with creative artists in Australia, and she showed me the most amazing creative outputs and artwork from these artists. Some who had no, connection at all to concealed pregnancy or infanticide, and 1 or 2 of the artists may have had some relationship or connection with concealed pregnancy. So it was it was, a difficult task to get. We got some funding and got to bring it to Ireland, and it was to open up that discussion really about the need for great sensitivity for a trauma-informed workforce of nurses and midwives and doctors and social workers who meet women and don't just consider women, just don't consider women to be mentally unwell. And of course they may be mentally distressed and going through a great degree of psychological, a psychological burden. so I suppose it's very important to open that discussion, and I felt that was what that exhibition had. You know, it gave us media exposure. It was something that people could come and view, and maybe they're thinking, you know, and
Yeah.
it was called, you know, the spaces between us. But I suppose in a gallery you have that capacity to hold space, but you don't have to talk. And the art was trying to give that message really about the trauma, but also, you know, that these were very strong and resilient women that had survived a difficult time in their lives.
It's beautiful that you did that, because as you said, it gave people the space to, number one, first exposure and opening up and showing that this topic is so important and needs attention and sensitivity, but also giving women and parents who may have a connection or had you know, experienced this for themselves, so that they could go without the need to talk, but you know, experience this and connect. So I think that was is a beautiful thing you did there. Wonderful. So with regards to the presentation, the Concealed Pregnancy Misunderstood Phenomenon here, that will be live here at the symposium, what do you hope our viewers will take away from it?
For me, the key message I would give is the importance of listening to women, and by making that connection and being a trauma informed and a trauma, you know, having an awareness of trauma sensitivity, I think that's pivotal to my work anyway as a midwifery educator. And that is really the key message, that you know, that we are able to signpost women at times of difficulty. So for some women who concealed, not all, I must emphasize, for some women it was stigma and shame, or perhaps they were young and weren't able to ask for help. But for some women, they did have a history of abuse, of sexual assault, and some women were living with domestic violence as well. And so that's my key message, is that it is important, not the message women wanted professionals to know, is that they did not want to be pathologized and seen as mentally unwell. And that we must consider, maybe somebody is not able to say they were aware of the pregnancy, they weren't planning it, that it was such a crisis for them, that they weren't able to ask for help, and that experience of disclosing prior trauma may take years. And so the kindness and empathy are terribly important during the birthing process and during that time, because the distress was so significant for some women that, you know, they did consider suicide. And it is a very grave time for some. So that's my message really, is the importance of empathy and listening and holding space for the women. One woman would have said, you know, nobody conceals a pregnancy if everything is hunky-dory. So there is something, you know, there's something going on, and it is about giving them time and space, and you know, to disclose what difficulty they had in their lives, or what they're living with.
Kindness and empathy. So valuable. Well, thank you so much, Dr. Sylvia Murphy-Tighe, for this, for sitting down here with me, talking about the wonderful work you're doing, and also the presentation that's coming up here at GOLD. Thank you so much.
Thanks, Kristen.
And for our viewers, if you'd like to find out more about this presentation and the other presentations at the Gold's Birth and Beyond Symposium 2022, you can go to goldlearning.com. This symposium will be live on October 17 and 18, but don't worry if you cannot be there live. All the presentations are recorded, so you can watch them at your convenience. Thank you again, Sylvia, for being here with me today, and thank you for watching, and I hope to see you at the symposium. Bye-bye, everyone.